Hi everyone, I'm Dr. Abdul Tofik and welcome to the today's session on osteoarthritis, one of the most common uh, and impactful joint disorder encountered in the clinical practice. Over the next 10 minutes, we'll explore its causes, clinical futures, and investigation management, and everything you need to build a strong clinical understanding. First of all, what is osteoarthritis? Osteoarthritis or OA. It is a chronic degenerative joint disorder that primarily affects the articular cartilage, leading to the joint pain, stiffness, and deformities. Unlike inflammatory arthritis, OA is mainly mechanical and degenerative. It commonly affects weight bearing joints like knees, hip, and spine. Uh, what is the definitions? The term joint arthritis was coined by John Speeden, but technically, osteoarthritis is more accurate because it is more about wear and tear, not inflammations. Think OA as a result of years of mechanical stress slowly wearing down to the protective cartilage of the joints. Types of OA. OA can be divided into two types, primary and secondary. Primary means idiopathic. No clear causes occur due to aging. Secondary result in trauma, infections, and anatomical abnormalities like these conditions. Um, Etiology. Why does OA happen? Let's break down the risk of factors: age, gender, obesity, injury, and genetics. Age most commonly affect after the age of 40. Gender, women are more affected than men, especially after menopause. Obesity, the only modifiable risk factor, especially for the OA knee joint. Injury, the fractures or ligament tears can lead to secondary OA. Genetics or hereditary influence. Hereditary influence is a stronger in OA of the knee than the hip. Even subtle congenital hip deformities can eventually cause degenerations. Think it. Pathophysiology. This is where the things get a bit of microscopic. Cartilages losses protoglycans becomes waterlogged or and starts fibrillated. Subcondylar bone becomes sclerotic and osteophyte. Those bony outgrowths start forming. The synovium may also become thickened or fibrosed. This result pain, stiffness, and eventually deformities. How does the patient present? Patient may feels pain under dull aging worsen with uses. The stiffness, especially in the morning after inactivity. Crepitus, the cracking sound, deformities like varus knee or fixed flexion deformities. Also look out the Trendelenburg gait in the hip OA or locking, giving the way to lose the bodies. Common sites of OA doesn't limit itself. Lower limb, hips, knees, ankles, spine, cervical spine, and lumbar spondylosis. Upper limb are fingers, means metaphyseal joints. DAP, PAP, beta, and thumb, CMC joints. When coming to TMJ joints, very common in the elderly people. Coming to the investigations, X-ray are main tool. Joint space narrowing, osteophyte formation, subcondylar sclerosis. MRI and CT scan are useful for complex or early stages cases. Important point: OA is a non-inflammatory disorder, so lab tests like ESR, CRP are usual for normals. Classification and grading for OA knee joint OA. ACR criteria. Uh, Lawrence grading method: 0 or normal, 4 is severe. 0, 1, 2, 3, 4. Normal, mild, moderate, severe. Severe with joint space narrowing and joint space uniformity maybe get presence. What are the conservative managements? Conservative managements are uh, now for the most important part of how do we manage OAR: medications like NASIDs, analgesics, topical agents, Physiotherapy like range of motion exercises, strengthening gait training, injections like corticosteroids or hyaluronic acids, lifestyle management, weight loss or activity modifications. A multidisciplinary approach yields to the best outcomes for the OA patients. May leads. What is surgical management? Surgical management in severe or unresponsive cases may be considered for the surgery. Osteotomy, realigned, especially in the younger patients. Arthroplasty, partial or total joint replacement. Arthrosis, joint fusion, usually last resorts. What are the complications? If we left untreated, OA can lead to joint deformities, ankylosings, loose bodies, secondary fractures, and earlier OA in the nearby joints. The what are the comparison of OA and RA? Let's wrap up with a quick comparison. OA mechanical stress, asymmetrical, and older patient may get affected. RA means autoimmune disorders, symmetrical stress, systemic signs, and morning stiffness lasting more than 1 hour. These are the common points for the OA and RA. Um, Osteoarthritis is not just an age-related joint wear and tear disease. It progressive biomechanical disease with multiple modifiable and non-modifiable factors. Early diagnosis and management can greatly improve quality of life. Thank you for watching. For any doubts and discussion, feel free to ask. And once again, thank you.